Welcome to this session on diagnostic medical sonography. I'm Christy Flowers, the program director for the sonography program here at Augusta Tech. So my contact information is at the end of this slideshow. Please take it down. You can email or call me if you have any additional questions after watching this. We wanted to put this together so everyone has a virtual way to get information on the programs. So let's get started. What do sonographers do? So we used specialized equipment, which is our ultrasound machine and our transducer, to create images of the body. So those images on the right side of the screen, they are produced with high frequency sound waves. So we use those images to help a doctor in making a diagnosis. So we see with sound. There's 4 different specialties for sonography. There's general, there's obstetrics and gynecology, there's vascular, and there's echocardiography. So the Diagnostic Medical Sonography program teaches general and obstetrics and gynecology. Augusta Tech also has a vascular and an echocardiography program. They're just not housed underneath Diagnostic Medical Sonography. They are all sonography programs. They all use ultrasound or sonography. We just focus on different parts of the body. So again, my contact information is at the end. So if you want more information on those programs, let me know and I can get you in touch with who you need to talk to. So a little more about what we do. We do get to work with all age groups of patients, infants all the way to elderly. We get to work with healthy patients, even those that are critically ill, maybe in ICU. We use new and advancing technology, which is always changing. We do get to look at a patient's symptoms and their lab values and know how to adjust our exam based on what our patient needs. We would provide basic patient care, including blood pressure, pulse, and respirations, temperature, and we are the eyes for the physician. So again, we use that transducer and we can look inside the human body at all different types of organs and structures and give the physicians information without having to open up or do surgery. So where do we typically work? So hospitals are going to employ more than half of sonographers. Physicians' offices, doctors' offices, they employ sonographers. Imaging centers, so those that just perform different types of imaging like x-ray, CT, MRI, will also have ultrasound. Traveling ultrasound companies, so these you'll get, temporary assignments. Maybe it's a couple weeks or a couple months. You can travel all over the United States and even into Europe doing this type of thing. Ultrasound equipment companies, they employ sonographers to do the sales for the equipment that we use. So what does a work schedule look like? Your schedule is going to vary depending on where you work. But like I said, many sonographers are going to work in hospitals, and hospitals have 24-hour coverage. So they'll have someone that comes in during the daytime, another person that comes in the evening, and then another that does overnight. So that there's someone there in the hospital at all times to provide sonographic services whenever a patient needs it. Now, if there's a situation that a hospital does not provide a person there 24 hours a day, they have to have an on-call service. So that means someone will have to be on call and get called in whenever there's an emergent patient. Now, private physicians' offices, like many of our OB offices, they're going to have 8-hour days, no call on the nights and weekends, but those jobs are not as readily available as those in a hospital. A lot of times you've got to take those jobs in a hospital, kind of put in some time, get some experience before you move into jobs that don't have evenings or weekends. Imaging centers and primary care centers, we have some of those in our areas. They offer some extended hours, maybe 10 or 12-hour days. And then they'll have some Saturday mornings for people who don't want to take off work to come to their appointment. So what does our salary look like? So for a study done specifically in Georgia, the median salary was $62,320, which was $29.96 per hour. So I think that's a good assessment for our area once you've been in the career for a little while. So coming out of school, most of the sonographers are making $22 to $27 an hour. That's going to vary depending on which hospital you take. If you take a full-time job versus taking a as-needed or PRN job. The jobs, of course, that are full-time come with insurance, etc., so you don't get paid quite as much per hour as if you don't take the benefits. So sonography was ranked one of the top 5 best jobs in 2016. That's based on income, stress level, hiring rates, and growth outlook, and that was a CBS News report, and that was not just healthcare, that was all different types of industries. So I do have this video. I think it does a good job of describing sonography in this quick video, so I'll just get it going.
Sonographers are an elite group of medical professionals who use ultrasound technology to see the body's organs, tissues, blood vessels, and musculature. Sonographers are on the front line in the early detection and evaluation of high-risk pregnancies, women's health issues, cancers, heart defects, and arterial blockages. The sonographer uses their knowledge of anatomy, physiology, and physics to place a small device called a transducer against the skin in the area to be imaged. The transducer sends high-frequency sound waves into the body, which are bounced off internal structures in the body. After the sonographer makes the necessary adjustments on the ultrasound machine, a computer analyzes the reflected sound waves and creates an image of the structure. But unlike X-rays, no radiation is used. Sonographers can specialize and be certified in scanning different areas of the body. Abdominal sonography captures images of the abdominal cavity. OBGYN sonography focuses on women's health issues, including pregnancy. Musculoskeletal sonography concentrates on muscles, ligaments, tendons, and joints. Cardiac sonography evaluates the heart and its blood flow. Vascular sonography evaluates the blood flow of peripheral and abdominal blood vessels. And breast sonography confirms the presence of cysts and tumors. Sonographers work closely with physicians and care providers to diagnose disease and are employed by hospitals, physicians' offices, walk-in clinics, and medical and diagnostic labs. It's an exciting and challenging career with tremendous opportunity. The Bureau of Labor Statistics predicts employment growth of about 26% between now and 2024, which is more than most professions. The median base hourly wage for sonographers is $34 per hour, which is over $70,000 per year based on a 40-hour work week. Sound interesting? The Society of Diagnostic Medical Sonography is an excellent resource to help you learn more about becoming a sonographer, getting certified, continuing your education in the industry, and getting the assistance you need to advance your career. Picture this rewarding career as yours. Visit sdms.org.
Okay, so those, I will note those salary predictions, etc., the $70,000 a year. Now that is national. So if you were to say work in California or in New York, you may make more money than you would in Georgia. So I just wanted to note why those numbers are different. So important traits and characteristics we think you need. Being compassionate. Sometimes we don't see our patients at their best. They don't feel good. They're scared. They're worried. And so we've got to be compassionate for them. You have to be good with technology. Excellent hand-eye coordination, being very detail-oriented because we have to find sometimes very small pathology in patients, being able to concentrate in busy environments and handle stressful situations, enjoy learning because our career is always changing and advancing, and you do have to get continuing education credit hours every year, just like with any health career, and then being strong in anatomy and physiology and physics. So anatomy and physiology is what we look at day in and day out, and physics is what drives our ultrasound machine. So you actually take an ultrasound physics course once you're in the program. So technical requirements, you've got to be able to communicate well with patients and others, perform sonographic tasks for 8 to 12 hours, depending on your shift. You're going to be standing the majority of that time, helping to assist patients with and positioning them for procedures, being able to move and manipulate your sonographic equipment, pushing your machine to go do portables, work in a very dim lighted room. So we work in very dark rooms so that we don't get shadows or reflections on our screen. And then assist the physician during invasive procedures such as amnios or biopsies. So a little information about the program. It is an Associates of Applied Science, so it's 6 semesters. Now 2 of those are mapped out for your prerequisite classes. If you choose not to do those in 2 semesters, that is perfectly fine. The 4 semesters for the sonography classes are mapped out for you, so you have to do those full-time, daytime classes. So our program covers general sonography, obstetrics and gynecology, small parts, pediatrics, invasive procedures, and then we do an introduction to vascular sonography, and we're going to talk about those. So what do I need to get into the program? Well, first of all, observation in the field gives you a great understanding of what a sonographer does. Observation is not required for you to get into the program, but if you're not sure if this is something you want to do, you kind of want some more information about it or to see it real hand, observation for firsthand, observation would definitely be the way to do that. And like I said, my contact information is at the end. I can give you some information of some people that are willing to do that. COVID may change some of that, but hopefully people will still be willing. So it is a competitive program to be considered. You have to have a minimum GPA of 2.75 on all your prerequisite courses. And then you have to take a test called the TEAS test, and you have to score at least 58.7 to be considered. The ranking is then based on your anatomy and physiology grades. That's anatomy and physiology 1 and 2 and your 2 labs. That's 70% of your ranking, and your T-score is going to be 30% of your ranking. So these are the required prerequisite classes. These are on our website if you can't jot them down, but you can always pause the video and write them down if you'd like to. So all of these have to be completed prior to you applying for the program in the spring, or which will be has to all be completed by May of whatever year you are applying to the program. So some considerations before applying. Like I said, sonography classes are full-time, daytime classes. Clinical rotations are at hospitals and clinicals, and they're mixed in with every class in every semester, so you end up having 4 clinical classes. Protocols and procedures are a big part of sonography. So every organ or fetus you sit down to scan, you have a set number of pictures that you have to get, and it's very much a protocol that you have to follow when you sit down to do it. Clinical situations can be very high stress at times. You have to be able to maintain a high level of professionalism. And then I do want you to understand that the medical field is a service field. You are there to help your patients, and sometimes you put yourself at risk in doing that. There's going to be times that you're exposed to blood or other infectious materials, and we do practice standard precautions. On top of that, right now with the COVID-19 pandemic, sonography would definitely be one of those jobs that would be considered essential. You would still be in the hospital performing these exams, even on patients that have COVID, of course, with proper protective equipment. But this would not be one of those situations where you would get sent home. You would still be working through this. So let's talk about a little bit of what we scan. So if you look over here to the left, of course, obstetrics and gynecology is what a lot of people associate sonography with. These adorable baby pictures, this is a 3D image and this is a 2D image of a fetus. So this up here is actually a non-pregnant uterus. So a lot of times people don't realize that we do so many studies on non-pregnant uterus. This is an internal exam called a transvaginal exam, so that we can look at if a patient's maybe having bleeding problems or pelvic pain in the female. So abdominal organs is another thing we look at. This is a gallbladder with a gallstone. This is a kidney with blood flow. This is a liver, a pancreas, and a spleen. So we can look at all those organs within the abdomen. We do an introduction to vascular. So we look at the carotid arteries in the neck and the lower extremity venous or veins in the lower extremity in the legs. Amniocentesis and paracentesis. So I have a lot of people that come to me and they say, oh, well, I want to do sonography because I don't like needles and I don't like blood. Well, I do want to be honest. I can't tell you of any area of sonography that you could go into that you won't have to deal with any needles or blood. The more they realize how helpful sonography is with real time and them doing procedures, the more they want help with that. So this is actually at the top. This is the amniocentesis where we take fluid from around a baby. So here's the baby, here's placenta. This bright area here is the needle coming in. So we guide the doctor to where a good pocket of fluid is so that they can go in and get fluid to send off. This is a paracentesis, so a lot of different disease processes, whether it be cirrhosis of the liver, hepatitis, things like that, cancers can cause an increase in fluid in the abdomen. So this is the needle here. Again, we guide the physician to this black fluid, so they go in and remove it, and you can see the difference here in this patient, how much fluid they removed. Makes the patient much more comfortable. Small parts is another thing that we do. So this is a thyroid. This is actually a cyst inside of a breast. This is a scrotal exam. So those are all part of small part scanning and things that you'll learn in the program. So here is contact information. So again, I'm Christy Flowers, the program director. There is my phone number and email. Autumn Milburn is our clinical coordinator and also an instructor in the program. So there's her contact information. Now, Melissa Birch, she is an academic navigator for Allied Health, and she is a wealth of knowledge, especially if you have questions about transfer credit or registering for classes. She's actually the one that does the ranking for the program. So, you know, if you're worried about, do you have credit? Have you taken the right class? She is great to reach out to once you've gotten your transcript sent over or if you're taking classes here at Augusta Tech. I thank you for joining me today. Again, please reach out if you have any additional questions. Have a great day.